Jennifer Lopez has been around for a while and top celebrity, beautiful, elegant, she's done it just right. Kind of in her early 30s, you can notice a few small changes happening here. Her nose looks a little bit more narrower, her cheeks look a little bit fuller, and her skin overall looks a little bit more shinier than it did earlier. So usually her skin gets duller. I'd have to say that quite possibly she's had a rhinoplasty done. The bridge of her nose looks more narrow, her tips looks a little bit more refined and not as bulbous and wide as it did in earlier years. And the width of her nose has narrowed slightly, meaning that she's had an alar reduction of some type. With her fuller cheeks, she's probably getting some filler, probably some hyaluronic acids, but very nicely, tastefully done, not overdone at all. Probably some skincare treatments, I would assume, to make her skin look shinier. She's probably had a little bit of Botox, also very nicely done, not over the top. Throughout her 30s, I'd have to say she's kept up on these treatments. It looks like she's getting her fillers, her Botox possibly, non-invasive treatments to keep her skin shiny. I really don't see too much of a difference. Then as she gets in her 40s, she still looks like she's getting a little bit more filler. Her lips seem a little bit fuller, but also very nice, proportionally done. The upper lip is always a little bit smaller. The lower lip is always larger, which makes me think that she's getting some lip fillers. Her jaw is starting to look a little square, which means that she's probably had some fillers in her jawline. I doubt she's had jaw implants, which could be done usually through a cut inside the later 40s. It looks like she might have had another procedure done on her nose. Her tip looks a little bit more refined, a little bit more narrow. And when she looks up, you can see inside her nostrils where you couldn't really see that before. So I suspect she may have possibly had a secondary rhinoplasty procedure done. So around 47, it looks like she's getting Botox, her lip fillers, probably some cheek fillers. It looks like possibly some nasolabial lines, because usually that gets a lot heavier, and hers really have gotten lighter, not heavier over time. In her 50s, her face looks a little bit more sculpted, especially in the cheek area. So I suspect she may have had at that time a buccal fat pad removal, which is a fat pad which is taken out from the inside of the mouth so that you can't really see the scar. And it's this fat pad right around here, which can make the face look more chiseled and more defined. And I would say she's probably had possibly something to tighten her upper and lower eyelids because they just look so tight and maintain that well. I'd have to possibly suspect that she's done like a little tweak here on her upper and lower eyelids, because most of the time your upper and lower eyelids as you age just don't stay that tight. Overall, I thought she looked great. She's maintained herself right. She's done it very well. She's invested a lot in this, and that's what it sometimes takes to maintain those youthful looks. I hope you've all enjoyed this, and if you're interested in discussing how you can maintain your looks, I'd be happy to see you for a consultation in my office.